Good morning, everyone, or afternoon, wherever you are. This is Dr. Mikolai Rashek of Neurogenomics, and I am continuing with my update on reviewing science, published science on the latest mRNA vaccines. So I have some really exciting news for those who are big fans of the vaccine. There's finally massive data came out from Israel, from Health Ministry of Israel, showing the effectiveness of the vaccine. So there was a number of different pillars of information that I personally wanted to see, and some of the published evidence finally satisfied my desires for what I wanted to see. So let's start off with what has been demonstrated. This study has shown among 600,000 vaccinated people, so this is real life data, uncontrolled, we're talking about just regular people, that approximately 90% or higher effectiveness of vaccine is seen across all age groups after the second dose. And what's important is that finally the study showed that this vaccine was effective, and it demonstrated this high level of effectiveness in the old age demographic group. And why that is important is because prior to the approval of these vaccines for public use, we actually did not have data of this really. As I was previously mentioning in my first video in this series, is that when these vaccines were approved, there was almost no evidence showing effectiveness of these vaccines in that particular demographic. And we simply extrapolated that effectiveness. So while we decided to obviously vaccinate all the older people because they are at the highest risk, there was really no data showing that this is going to work. We finally had that first data to confirm, so the massive experiment has worked, and so that's the first big news. Another important information that this study has shown is that the vaccine appears to be curbing transmission of the virus. So this and another important study from UK, also published around the same time, has also demonstrated that. So that's really good news. That's both amongst individuals who are asymptomatic or symptomatic. It appears that once you become vaccinated, the likelihood of you becoming infected is going to be reduced. Once again, this might come as a surprise, but this information was previously not known, and that's not why these vaccines have been approved in the first place. They were approved for the ability of these vaccines to diminish the likelihood of you developing severe adverse effects associated with COVID-19. So now we finally know that not only do they actually recapitulate what has been shown in clinical trials, it also appears that it does effectively stop transmission amongst people if they are vaccinated. So this is really fantastic news. It really increases my own level of satisfaction of information related to this vaccine and the quality of this vaccine. And the information is based on, at least for now, unlike the previous studies demonstrated to us, is this information is based on thousands of individuals, hundreds of thousands of individuals. So this is fantastic. And the reason why Israel can afford to provide this information for us is because they are the leader in the world in terms of their vaccination effort. So that's great news. What I still would like to be able to see is demonstration what these vaccines do on a molecular level. And not because I have any suspicions, but it's because I would love to be able to put any suspicions to rest, and basically ensure that there's nothing weird going on because of the fact that vaccines are being administered on a molecular level. Meaning, remember, when you take this vaccine, what really happens, you have a genetic material in the form of RNA that is trapped in a little ball of fat, and then our cells uptake those little balls of fat with that genetic material, and then our cells basically use that genetic information in the form of RNA like all of the RNA inside our cells, which is basically RNAs are used as blueprints to produce something inside our cells. In this case, the cells are tricked to produce the spike protein that are normally present on the surface of the virus. And then it's those cells that will put out those spike proteins on their own surface. So what we're doing effectively, as far as my understanding, is we are transforming subset of our cells to look like they're viral cells. And that's how we trick our immune system to recognize these bizarre foreign-looking cells as if they are virus and start producing mounting immune reaction to that specific spike protein, so that when you are actually infected with the real virus, you have built-in immunity against it, so you're not gonna get sick. But when these cells express these spike proteins, remember, spike proteins can interact with our own receptors on our surface cells, which allow viruses to enter our cells. So does that actually introduce any communication between cells? We need to investigate that, number one. And number two, does that actually affect any specific genetic expression within those cells? So I would love to be able to see that data. If I see this type of data, this will be my last gap of knowledge that would alleviate all of my worries that I might have had associated with the quality and effectiveness of these vaccines. But so far, the data that's coming out looks fantastic, and it actually probably surpasses anyone's expectations of how amazing these vaccines are. However, I will also add that in my previous video, I talked about a database, a public database that's available in the United States called VAERS, VAERS, and that database was built for being able for anyone to report any adverse side effects associated with vaccine. However, that's based on that individual's assumption that the reported side effect is in fact tied to the vaccination, whether that's true or not. Nobody is actually checking that database for accuracy and whether that information is true, and the database itself clearly states that the fact that these reports are made and that this information is cataloged, that does not mean that these side effects are true product from the vaccine or from inadvertent action of the health provider who was vaccinating an individual. But I find this database still really fascinating, because really what that database represents is what do the people think. And most of those reports are actually based on healthcare providers putting that information in on behalf of their patients. So this is really public's perception, and that's why that database was created, is to see what does the public see, and if there's any large signals of information of something really bad happening, then we can capture that. Now, why do I mention that is because COVID-19 vaccines suddenly have a massive spike of reporting of a variety of different side effects. They can range from very mild to more severe. But what is really interesting and worth noting, and eventually probably requiring proper investigation, is the fact that there's a massive spike of reported deaths in relation to use of the COVID-19 vaccines. So these are, I'm talking about mRNA vaccines. United States and Canada just recently approved another vaccine there that's not an mRNA vaccines. My personal interest is in the mRNA vaccine, so that's where I really place my focus, because that's a new technology that I find very fascinating, and I'm hoping obviously that this technology will transform use of our future medicine. So far there was more than 500, approximately almost 600 deaths reported in that database in January, and almost 500 in February. It's astronomical in comparison to what has ever been reported previously in the history of that database, which is about 30 years old. The highest ever monthly reported death count ever was about 30 deaths, and that's in that span of 30 years. So you can see now when we're getting into several hundred a month, it's anomalous. Now again, that does not mean these reports are true and accurate and they are really tied to COVID-19, but that's not the point. The point is that this is what people are thinking and reporting. And therefore, at some point, we need to be cognizant that when we reach a certain threshold, we need to start investigating this to determine how accurate that actually might be, and therefore how potentially dangerous these vaccines might be on that account. And especially since when I checked, the vast majority of those reported deaths, about 80% of them are in people of 65 years of age or older. So clearly we are already entering a demographic where deaths will be more common than in the younger age groups. And therefore it's easy to potentially make a wrong assumption that witnessed death was anything to do with the vaccine, where it might have been due to other completely unrelated causes. But because the numbers of reported deaths are so high, sooner or later we need to have that information investigated, and I'll be looking for that information. As soon as I find out, I will report on that. And I always welcome any information or scientific information that you might come along, send information for, post a link. If you like this video and you enjoy this content, give us a like, subscribe to the channel, and I will continue making videos on science related to the novel and exciting mRNA vaccines. Once again, this was Dr. Mikola Rashek of mRNA, and see you next time.